what is habituation? Now, can anti-anxiety medications or antidepressants stop habituation? That process to habituate does rely on the limbic system's function. There's a filter mechanism which can be manipulated and adjusted according to certain factors. One factor is our own health, our own anxiety or stress levels, and that usually is in our favor because if we can de-stress and get the right kind of information about tinnitus, then that can help that system over time. Now, there has been some reports, there has been some science to show that certain kinds of drugs, specifically the benzodiazepine drug family, can potentially slow down that natural brain mechanism of habituation. This is something that I first learned studying under Dr. Paul Jastroboff, who is the founder of tinnitus retraining therapy, and this has been cited in other neuroscience research as well. Now, from anecdotal stories, from talking to patients, from talking to other professionals, using those drugs for a shorter amount of time is not a problem. If your doctor is recommending it, there's probably a good reason, and there's overall not a big problem with using them for a short amount of time, especially to get through a period of high anxiety or insomnia. If you have a choice, if your doctor approves other medication of a different drug family, then you may want to consider that, because long term, all things equal, I would prefer you to not be on benzodiazepines if you are trying to habituate to tinnitus during a retraining period. Now, that said, I am not a physician, I am not a medical doctor, so you have to understand that there's much more personalized aspects of this that I don't know about you. So if you're considering this, really rely on your physician and try not to be in fear, try not to be scared. It's okay to take low doses of benzodiazepines and you can still habituate. It's okay to take other doses of benzodiazepines if your doctor is recommending it. I'm coming at this from an audiology lens and trying to advocate for you to let you know what to look out for. Other kinds of anti-anxiety medications, antidepressants, typically they're helpful, not hurting. So that's my take on this, is that none of this is likely to stop habituation. You will habituate. You will get better and better with the habituation process, right? Over 80%, over 90% of patients typically do. Now, my other information on this that I need to share is that there's no way to stop habituation. It's more about what rate will you progress with your habituation. So I hope that helps. And again, just take it, just exhale, just breathe with me. You're going to be okay. This tinnitus is not a curse. It's not going to stop you. You may see some negative comments. You may see some negative information online with Facebook groups, with online forums. Hey, you may see some negative comments under this video, but that doesn't mean it's going to be you. So follow what happens for most people, and I assure you things will work out.